So I was offered both the great honor and great challenge to introduce my dear friend and colleague, Pat Walker. The honor is obvious to all of us who know Pat and love her as we do. She is an esteemed, accomplished colleague as well as a dear friend. And she leads relentlessly, yet in such a gentle manner, one can't be helped but be warmed by her charm. The challenge, on the other hand, is to sum up the story of this soul in a brief 10 minutes. So I'll attempt to do that with a little bit of pointillismo through a series of slides. So the early years, Pat was born in Taipei, Taiwan, and moved to Bangkok at age 5 during the Vietnam War. She didn't move back to the U.S. until she was 11, but she spent the next 10 summers in Thailand and Laos until med school. There are some pictures here of Pat and her sister and some of the mentors who influenced her life in these early years as she became multilingual as a young child. So here is Pat and her family around 1958, sunbathing in which would become one of her favorite hangout spots in Maine. And many stories had been told of her time growing up. This is Susan and Pat in 1959. Her older sister Susan was 7, Pat was 4, and they were living in Taipei while their father flew planes in Vietnam, Laos, Cambodia, and Taiwan. For those of you that haven't seen it, Tom Cruise plays a Hollywood, the role of Pat's father in a recently released Hollywood movie. Pat's father, Frederick Frye Walker, flew Air America CIA secret missions from 1954 to 1979, during which time she heard the stories of many exposures to tropical diseases: cholera, measles, famine, rice drops from the Air America planes. What he instilled in Pat was a strong sense of curiosity, the spirit of adventure, and certainly an openness to other cultures and multiculturalism. Pat recalls that Dad taught us, quote, to strive for excellence, always have an alternate runway and enough gas to get there, never take off or land without a checklist, as she notes, long before checklists became a popular tool to keeping us all on track. Here's a picture of her dad with the 3 sisters. During the early years in training, 1979-1980, when Pat was a third-year medical student and the Cambodia genocide was going on, many were slaughtered and some survived. 4 million survived by living in Cambodian refugee camps in Thailand on the Thai side of the border. As a third-year medical student, she got a call from her sister who said, "Pat, you just have to go." And Pat replied, "It was a no-brainer. I was going home, going back home, but going in the comfort of being guided by my ancestors before me." Pat enrolled and volunteered with ARC in Minnesota by saying, "I'm still pretty young at this clinical medicine stuff, but I speak Thai and I can help with logistics." She was quickly assigned to the second response team. Here's a picture of Pat with the ARC response team on the porch in 1979. Pat had her first exposure to some of the complex tropical medicine problems at this time. There's a case of Madura foot that was a consequence seeing a woman with leprosy walk with a desensate foot across long stretches. Here is Pat with some of her early mentors, including Dr. Solomon Kucher and paramedic John Lepaco. Another mentor, Dr. Larry Kaplan, conducting a class among the aspiring medics at the time in Thailand. Pat has always been a committed lifelong learner as well as a lifelong teacher, and this shows her in both roles being engaged here. She was, even at this early age, committed to being present with the program coordinator and graduating medics who she strongly influenced at the time. Now, she wasn't all work. Pat had this same sense of adventure that I think she got from her father, and saw the countryside on motorcycle, reminding us these are the things that your mother told you never to do while you traveled. I sense that a certain amount of guilt after this trip led Pat to take time to pause out and write letters home, reassuring her mom that she was well and maintaining that strong family connection that Pat always had. Pat would next return to Vietnam to work in refugee camps in 1987 and 88. Some pictures shown here. She was always committed to responding to complex humanitarian crisis, both in terms of what she could learn as well as what she could offer in terms of her teaching. Pat always understood the depth both of human suffering, but also in the context of human resiliency, and this would strongly shape her career. She maintained the connection with Southeast Asia and with Vietnam throughout her career, returning many times for trips. Here's a picture of her in northern Vietnam with some of the Vietnamese children, and frequently holding a camera, which we'll come back to later as we talk about some of Pat's other highlights. One of the things that most distinguishes Pat in the ways that many have known her is her tremendous amount of compassion as a clinician healer. Pat was the founding director of the Center for International Health at Health Partners in Minnesota for over 24 years. She's the primary care internist for immigrants and refugees, as well as having a travel medicine and tropical medicine clinic on the side. She is described by her colleagues as the go-to person for difficult diagnostic dilemmas and physical exam findings. Pat especially loved the tropical rashes and examining in detail the heart. She maintains this skill today to examine the heart in many ways. One notable elderly Vietnamese woman was overheard telling Pat, "I just want to come back to see you every 2 months, if that's okay, because I feel so much better just having seen you in clinic." Pat is the quintessential listener and observer during her encounters with patients, and she is always praised for her bedside manner. Here's a picture of Pat maintaining eye contact, even in an era of electronic health records and communications, which often distract many physicians in practice, but not Pat, and also with an interpreter in the background. Pat asked very early in her career, what is the knowledge base, the attitudes and practices that are necessary to provide the highest quality care to immigrants and refugees? This resulted in a landmark first-time textbook that she and Elizabeth Barnett put together in 2007. This book in immigrant medicine was the first of its kind and awarded in 2008 a highly commended book award in public health by the British Medical Association. Pat has published over 75 publications in peer-reviewed articles, book chapters, professional reports, and educational videos, including an award-winning documentary film called The American Heart, which came out in 2013 and has won 6 separate awards for documentaries. Chris Newberry was the filmmaker. This film was 7 years in the making, and it takes viewers on an intimate journey into the lives of 3 refugees who now called America home. Thor Lem, a former political prisoner of Cambodia, Patrick Jr. from Burma, and Alex Glyptis in Ethiopia. Pat's scholarship in refugee medicine is known internationally, and she is frequently sought speaker on the topic. She is recipient of several CDC grants that we have provided because of the Centers of Excellence grants and model for clinics in refugee health. She was a pioneer in refugee health long before anyone else, and she had committed her head, her hands, and her heart to the health and well-being of refugees. She and her colleagues have established the reference standard for culturally sensitive care and treatment of refugees throughout clinics in the United States, and they are simply unparalleled, and we are proud to fund and support them as models for refugee clinics around the country. But not only is Pat an outstanding clinician with a broad palette of international experiences to draw upon, but her inquisitive nature propels her to ask really tough questions, critically evaluate programs and their policies, and strive to use data in decision-making to move the ball forward in this field. Pat is also an excellent mentor and leader. She founded the Global Health Pathways Program in the University of Minnesota Department of Medicine over 14 years ago. This program brings together medicine residents, med-peds residents, med-derm residents for work at the center and in multiple field sites that Pat has established abroad. She has tracked these University of Minnesota students through the ASTMH course, and it's one of the only residencies which renders its graduates eligible for the certificate in tropical medicine. There are over 100 graduates providing primary care to refugees and multiple pursuing subspecialties and bench research in tropical medicine. Several are working at CDC. One, notably Bill Stauffer, who works in our program. They have gone on to do EIS training and other fellowship opportunities. There are many illustrious mentees from Pat's training, including ASTMH members that are here in the room. Joya Mukherjee, who's currently the Chief Clinical Officer and Partners in Health. Cameron Kahn from Blue Dot at the University of Toronto. Dave Bulware, doing HIV work in Uganda. And Bill Stauffer, as I mentioned, doing med-peds and ID at the University of Minnesota and CDC. Pat has also sponsored bilateral exchange programs with Chiang Mai University in Thailand since 1997 and brought over 50 U.S. residents to Thailand and many Thai MDs who've graduated and trained in University of Minnesota residency programs. Pat helped us launch the simulation exhibit at last year's annual meeting in Atlanta, this refugee health exhibit called The Journey to Wellbeing, which Pat and Karen really played a big hand in bringing forward and helping us create this exhibit for ASTMH members. Here's a photo of Pat last year taking over the gavel as president of the society. She has had an illustrious year by all who look on at her accomplishments. There are many, and I'm sure you'll hear about some in her address. But I just wanted to highlight one about reaching out, having the society reach out in other countries. This is a picture of Pat over the past year in Peru, where our former colleague, Alan McGill, who is always honored and celebrated, and Pat reaching out to the Peruvians to engage and increase membership. Tropical medicine and refugee health, immigrant medicine is one of Pat's major passions and love, as I hope I've shared, but she has many other loves to her life, including a strong sense of joy of being in the outdoors. Here's a picture of Pat hiking in the White Mountains. She loves New England and spends a lot of time up in New England, particularly at her house in Maine. She's an avid photographer, always carrying a camera and taking pictures to capture the spirit of those she encounters, and lover of flowers, shown here with orchids in Thailand. Thailand remains a passion for Pat, and she travels back there regularly to a place that's like a second home to her. She's also an avid birder. I receive many stories of her birding adventures that they're not time to share here. But it's clear that Pat has a strong ability to connect with nature as well as with her colleagues and patients. Well, Pat, like all of us, knows in our heart that our careers stand on the shoulders of others who lift and anchor us. These are our people. These are mentors and friends, family. And if there's a village chief in this story, it's obviously Becky Enos, Pat's partner of 23 years. Pat and Becky were finally married in September of 2015 when the laws changed. And Becky, let me publicly thank you for not only supporting Pat with all your generosity, but also with sharing her with all of us in this society. We are grateful to have you here. And with that, let me close and introduce your president, Patricia Walker.